Congratulations, doctor. The white coat fits, your name badge finally says doctor and indicates that you're an attending physician. You made it. You made it through training, you made it through medical school, you made it through those sleepless nights, you put up with the missed family events, the holidays celebrated while on call or in the call room. You finally signed your contract, have your signing bonus, and you're starting your first real big doctor job. And now that you've been practicing a few days, all of a sudden, the dream job feels just a little heavy. There's this unexpected weight. Not from the hours, and not from imposter syndrome or self-doubt. You made it through everything and you kind of convince yourself that you belong. It's just something else that you can't put your handle on. You're in the middle of an expected major transition in your medical career, and what no one tells you is just how disorienting the leap from resident to attending can feel. If you feel a little bit lost, you're not alone. Nearly 2/3 of physicians report symptoms of burnout, and some of the highest risk comes after training ends, when you're handed autonomy, responsibility, and no roadmap for what comes next, and no guardrails that exist in training programs or in medical school. So if you're wondering, is it supposed to feel this way? The answer is yes. And also, there's a better way forward. I founded the Developing Doctor to help physicians make career transitions more easily than they could without support. So keep watching, like, and subscribe if you find this helpful. Why is the transition from residency to independent practice so hard and so misunderstood? We talk a lot in medicine about moving from pre-med to med school, from med student to resident, and each transition is marked by rituals, structure, and mentorship. But the shift from trainee to independent physician, it's a little more like, congrats, you're on your own. Here's your signing bonus, sign your contract. Good luck, meet your RVU metrics. Residency comes with guardrails. Even if you're running on fumes, someone's always co-signing your orders. Attendings carry the final say, and they carry that final weight. But now, you are the final say. One of my colleagues, who's a pediatric hospitalist about 3 years into practice, put it this way when I talked to her about that transition. In residency, I stayed up late studying. Now, I stay up late wondering if I made the right call. The pressure's quieter, but it's deeper than it was in training. And it's not just a change in role, it's a full identity shift. And like any transition, it comes with some turbulence. Here are a few things that every new attending should know that I think would be helpful. First is that it doesn't get easier, it just gets more yours. A lot of residents think, once I'm done with training, I'll finally be able to breathe. I'll have more time, I'll have more energy, I'll have more space. I can reconnect with the person that I was before I started training. But here's the truth. Yes, independent practice is less micromanaged, but it's not necessarily easier. There's not necessarily more time, and you definitely don't have more energy. It's just different. Sure, the hours look better on paper, but now everything falls on you. Documentation, billing, patient safety, clinical decisions, end-of-life conversations, staff management, and staffing logistics. An emergency medicine colleague who I talked to about this transition summed it up like this. I expected freedom. What I got was ownership. I wasn't prepared for how that would feel. That ownership, however, can also be empowering, but it is isolating. Which brings us to the next issue. The learning doesn't stop, it shifts gears. One of the biggest shocks that you may experience when you transition from residency to independent practice is that you're going to find yourself studying and reading more. But now it's not for exams. It's just because every decision matters. Clinical questions become real-time, high-stakes puzzles. Guidelines evolve, cases get more complex, and there's no attending to double-check your gut. And medical knowledge doubles every 73 days. Think about that for a minute. One of my colleagues who works in internal medicine kind of put the knowledge issue this way. I look things up constantly now. It's not about proving I'm smart, it's about doing right by my patients. This is why many new attendings feel imposter syndrome after residency. It's not that they're unqualified, it's that the learning has just entered a new lifelong phase, and you learn differently in independent practice than you do in a structured training program. The next important skill is the ability to say no. During training, you said yes to everything. Extra shifts, committee meetings, the presentation no one wanted to give, in part because you felt a sense of obligation, and you thought that you were just supposed to say yes. But that mindset no longer serves you well as an attending. Boundaries aren't a luxury, they're a survival tool. Saying no might look like this. Not joining that optional task force, protecting your day off, like blocking it off on your calendar, capping your patient panel before it becomes unsafe. You don't need to overbook clinic. It's not selfish, it's self-preservation. The irony is that saying no is what allows you to say a wholehearted yes to the things that matter. Your patients, your growth, your life outside of medicine. There's a difference between when something is hard and you're in like a hard season of your life and your career and something more serious. So when you start to feel the weight of independent practice, be honest with yourself. Are you emotionally exhausted, not just tired? Have you become cynical or withdrawn? Do you dread going to work, even when you're rested? Are you thinking about leaving medicine entirely or just fantasizing about disappearing? If so, it's time to pay attention. You don't have to crash before you course correct. One of my friends who's a family physician and coach ignored the science for too long. She said the following things. I thought burnout was for older doctors. I thought I was just adjusting. I thought what I was feeling was part of the normal transition. But eventually I couldn't hide it, not for my patients and not for myself, and definitely not for my family. Burnout in early career physicians is real, and it's not a personal failure, it's a signal. So if you're experiencing burnout, if you're feeling the weight of the white coat, do you need to make a change? Should you leave medicine? Do you need to quit jobs? What do you do? Well, the answer is not necessarily. For some, yeah, leaving medicine might be worth exploring non-clinical careers for physicians like consulting or looking at medical industry jobs or medical education or online telehealth or remote work. But for many physicians, it's not medicine itself that's the problem. It's the way we're practicing it, without boundaries, without community, and without support. So if you're in that gray zone, unsure of whether to change jobs or careers entirely, don't do it alone. That's where I come in, other physicians who you can find online come in. Physician coaching helps. It is a tool that many physicians ignore and don't utilize appropriately because they think it's only for people who are struggling or only for people who are burnt out or who need remediation. But really, coaching is for anyone who wants to create a path forward and are not sure what that path looks like. How does coaching differ from therapy? Therapy looks back, coaching looks forward. We talk about things like, what do you actually want for your career? What's working for you and what's not? How do we fix the things that aren't working and how do we amplify the things that are? What do you need to change in order to thrive? Maybe it's your job, maybe it's your career, maybe it's just something simple like prepping clinic notes. Sometimes the obvious answers are the ones that are hardest for us to find. So how does coaching work? It provides structure, accountability, and most importantly, perspective. Dr. Thompson, who worked with a coach during her early career transition, kind of talked to me as I was considering becoming a coach, and she shared the following information. I thought I needed to leave, but I didn't need to quit medicine. I needed to learn how to live medicine differently. I love that. Learn how to live medicine. Sometimes coaching is about having a sounding board and having a person that you can turn to when you're not sure who else to turn to. As we look forward to the next classes of graduating physicians, there's clear that there's a generation difference. This generation of doctors is navigating more than just personal growth. You're riding a wave of systemic change. Medicine is changing, society is changing. First, there's tech everywhere. From telehealth to AI, the learning curve keeps climbing. Even if these tools make some parts of being a physician easier, there's still tools that you need how to learn to use and need to learn how to adapt to. In addition, the way we practice is changing. The RVU-based model is probably breaking and may not be around for much longer or for your entire career. You're not just treating patients, you're proving outcomes. It's also okay to push back on toxic work norms, and rightfully so. Claim your personal time. And finally, there are large physician shortages across the country, which open opportunities up for people who want to look at remote work or locums work, but also place a lot of stress on the people practicing in those locations where they need colleagues and they don't have any. Being aware of these trends help you to lead your career instead of feeling dragged by it. So, do you want to navigate this transitional season of your career? Look for a support system. Community is a buffer against burnout. Look for professional support wherever you are. Look for coaches, look for mentors, look for therapists. They aren't last resorts, they're lifelines. Utilize them as you need them. So as you navigate this transition, just remember, you're not broken, you're not struggling, you're becoming the physician and the person that you were meant to be now that you're out of the confines of training. Ask yourself, what kind of physician do I want to be? What support do I need? What matters more to me now than it did before? If you're in this moment of asking yourself these important questions, you're not failing, you're evolving, and you don't have to do it alone. Remember, you're not just building a career, you're building a life. If the transition to independent practice feels heavier than expected, it might be time to get some clarity and support. I founded the Developing Doctor to support physicians at all phases of their careers when they reach transition points that were difficult and they weren't sure which directions to go. I offer tailored coaching that offers solutions to real challenges for early career physicians, from burnout to setting boundaries, from identity shifts to identifying new possibilities. So, if you want to explore how physician coaching can help you move forward with confidence, clarity, and purpose, click the link below this video to learn more about what I offer. This is Dr. Ben from The Developing Doctor. Thanks for watching. And if you have any more insights into what makes the physician career transition from resident to attending physician difficult, let me know in the comments below. I'd love to hear from you.